Welcome to our podcast, The Better You Are, The Better You Are. Whether it is physically, mentally, or spiritually, when you know better, you can do better. And when you do better, you'll be better. On this podcast, we share knowledge, expertise, opinions, and experiences. All things that can help you to change the game. By the time we're done, it's hard for you not to be encouraged. So join us. The better you are, the better you are.
So let's start off with some statistics. According to the American Cancer Society, breast cancer is the most common cancer diagnosed among women in the United States, and it is the second leading cause of death from cancer among women, only lung cancer killing more women each year. Over 300,000 new cases of breast cancer will be diagnosed, they predict, in 2024. 1 in 8 women will be diagnosed with breast cancer in her lifetime. And unfortunately, over 40,000 deaths related to breast cancer are expected. As with many other healthcare concerns, Black women are affected more aggressively, often with this condition. Black women are 40% more likely to die of breast cancer than white women and are twice as likely to die if they are younger than 50. Okay, I'm thoroughly excited to have our discussion on breast cancer today, and we have 3 fabulous speakers to be with us today. First, we have Valerie Dean. Valerie Dean was born and raised in Birmingham, Alabama. She is currently living in Pinson, Alabama, and is the wife, mother of 2, and the proud grandmother of 2 grandchildren. She works as an accountant for a major utility company. Her journey with breast cancer began at the start of the COVID pandemic when she became the caretaker for her mother, and continued through July of 2021 when her husband was diagnosed with Parkinson's disease. 2 years later, she was diagnosed with stage 2 invasive ductal carcinoma breast cancer, despite no known family history. Her diagnosis began with a fall that turned into a life-changing revelation, sparking a journey filled with realizing the faith, strength, and courage she didn't even know she had. We also have Letrice Johnson. Letrice Johnson is a 3-time cancer survivor. She has a diagnosis of Hodgkin's disease twice, as well as breast cancer. She has been cancer-free from her last bout for 14 years. She and her husband, Paul, live in Chicago. And when I reached out to her, she said she would be honored to be a part of this discussion. And last but not least, we have Dr. Monet Williams-Bowling. Dr. Bowling leads the breast cancer team at Hendricks Regional Health in Indiana. She is board certified in surgery and fellowship trained in breast surgical oncology. She hails from Decatur, Georgia. She attended Spelman College, where she obtained a BS in biology, and then went on to Indiana University, where she earned a master's degree in medical science and a medical degree. Her general surgery training was completed at Indiana University, and she completed her fellowship training at the University of Texas Southwestern Medical Center in Dallas. She is highly renowned in her field and a passionate crusader in the fight against breast cancer. Dr. Bowling is happily married to Don Bowling II, a teacher and varsity boys basketball coach at a local high school, and she is the mother of twin boys and a young daughter. She describes her family as the pride of her life and her most rewarding accomplishment. She enjoys creating wonderful humans that will contribute their gifts to the world. She always has a welcoming smile, and despite her busy work and personal life, she did not hesitate to agree to be a part of today's program, as did Valerie and Letrice. I thank you all for being here today, and I'm excited to get on with this discussion.
And, we kind of got a little shock about 2 or 3 weeks ago, because my husband has been diagnosed with prostate cancer, so that along with his Parkinson's. But all in all, they caught it early, and
Amen.
He's going to have surgery, and that's going to be cleared up. So it was like we were getting one bad news after another, but I still know that God is on the throne.
Amen. Amen. Absolutely.
Your thoughts, Monet?
I could go. I can't even. There are a lot of places that I can go. I'm going to just start because Valerie, I was writing as we were going along. And so many things. During the pandemic, as breast surgeons or as surgeons, period, and as doctors, we were asked to tailor the way that we treated patients, not tailor and do less for them, but only the absolute patients that had to come to the hospital needed to be in the hospital for many reasons, because the hospital was full of very, very sick patients in the very beginning of the pandemic. And so as a breast team, we were asked to only have patients be in the hospital if they were getting biopsied. I mean, that was one thing. The second thing is that the surgeries, if there was a possibility of being on chemotherapy or that the patient was going to need chemotherapy, they would get that and we would get that going. And then we would hold off on surgical treatment because back then we didn't know if we were spreading COVID-19 with putting people to sleep. There were lots of unknowns. So depending on when you were diagnosed within the pandemic made a big difference. And that the last thing we were asked is that if patients could wait to have their surgery than to do them once the disease had slowed down or we had a vaccine or all of those things. So there are so many things I could go in many directions. I do have a couple of questions just to make sure that I give the appropriate information. Your breast cancer was estrogen positive or not? Do you know that information? Were you HER2 positive? I would imagine you weren't because your report is out, but were you HER2 positive? Okay. So you are what we call ERPR positive, HER2 negative. Is that correct? Does that sound about right? And then congrats to the UAB team. There are an amazing group of doctors down there who it sounds like did kind of your testing all over, found out they did what we call scans to make sure that you didn't have spread of your disease. So those scans occur, it usually is either a PET scan, which is one way that can be done, or a CT scan of the chest, abdomen, pelvis, and a bone scan. So depending on insurance, those are how those things are done. Valerie had what is called neoadjuvant chemotherapy. What neoadjuvant chemotherapy is that is the treatment of your breast cancer with chemotherapy. There are dozens of regimens, but it's done before surgery happens. So that is neoadjuvant chemotherapy. We use that to do a multitude of things. One, to find the response of your bodies to the chemotherapy. So is the tumor going to shrink? Some people choose not to have their breasts removed and they want to save their breasts. And to do that partial mastectomy or lumpectomy, we have to shrink the actual tumor. And to do that, we give people chemotherapy up front. If your skin is involved, we have to give the chemotherapy up front because that is a part of the regimen. We've got to give you the chemotherapy and then we remove the breast. The other thing is if you have a more aggressive type of tumor, we have to treat it with the chemotherapy first. And that's typically reserved for people who have lymph node involvement too. And then we do our surgery. Valerie had what is called a complete pathologic response. And so that is when the disease in the breast is gone after the chemotherapy. So what you're left with is scarring. Okay, so they'll tell you that there were no signs around the area of the biopsy site, but she had what we call, it sounds like a micro-invasive lymph node. So what that means is that she basically got a complete response with the chemotherapy. There was little tiny cells that were left in the lymph node underneath the arm. And when they were removed, so those 8 total lymph nodes that were removed, it sounds like micro-invasive disease was left. And so when we're looking at micro-invasive disease, that does count as a lymph node being positive, but essentially she got a complete pathologic response, which is wonderful because that is what the chemotherapy is used for. That's why we do it. And then the rounds of radiation. So for those who get nervous about radiation, I try to explain it and liken it to insurance. Radiation is given, and you consider it like your insurance. You pay all the time. You continue to pay your insurance, and you pay for it because you don't want to have to use it. And so that radiation is given so that you decrease the chance of your cancer coming back. And so what radiation does is it gives you about a 30 to 40% decrease in the ability of your cancer to come back. And so that is what radiation does. Now, radiation has the side effects, and Letrice is the example of all of those side effects that can happen with radiation. The only other thing that I wanted to make sure of, congrats, you lovely ladies, on being survivors. This is fantastic. Welcome to the other side of the journey. I would love to say that. Welcome to the other side of the journey. I have a question. So, Letrice, you were diagnosed very young with your lymphoma. You had that twice and then still had a very young breast cancer. Valerie, you were not as young on your diagnosis, but then had what I would call a different staging of breast cancer. It sounds like it was about a stage 2 because of how everything was done with the lymph node involvement. But I'm guessing, and I don't know your specific pathology. I'm just going from what I'm hearing and written down. Were either of you tested for genetics? And I could imagine I know the answer, but I just want it to be very clear about that.
No.
Okay. So there are many reasons that I would ask that question. One is for, in Letrice's case, she's been diagnosed with multiple cancers. And so there is not a clear direct link with lymphoma and breast cancer. However, young cancers and also young breast cancer. And I know everyone will say, oh, it's just because of the radiation. That's why she developed that breast cancer. But there are ways to be certain of that. When people develop young cancers, I always suggest, I run a high-risk clinic. So full disclosure, I run a high-risk clinic where I see patients like Letrice all the time that are high risk because they've had LCIS on their biopsies. So we see them, we get MRIs and mammograms on an every 6-month basis. So we catch things very early. People who have young breast cancers, or they have multiple people in their family with cancer, period. When I first started this journey in being a breast surgeon, there were 4 genes that we tested for. In 17 years, we now test for 36 plus different genes that can be associated with all types of cancers. And those cancers come in clusters, okay? And so it is not necessarily that you're going to get the benefit, but your family would get the benefit, because knowing is half of the battle, right? And so there are a host of cancers: breast, prostate, melanoma, pancreatic, ovarian, that travel kind of on the same gene. That is called the BRCA gene, and there's BRCA1 and BRCA2. That's what we've tested for probably about 2 decades. But now we have genes that are popping up where breast cancer is less likely, but it's more than 1 in 8 women. And so those reasons, and for those reasons, I would suggest that you all be tested because it helps your family in the long run. It's a blood test. It can even be a spit test. 23andMe is not the test. Any of those tests are not the test. It is an actual test done in a lab to check for cancer-related abnormalities. So it's not a you mail it in type of thing. It is an actual test done at a breast office or at your primary care's office. And I say that because my indoctrination into all of this, my grandmother passed away of ovarian cancer. I wanted to be sure that I took care of cancer patients and knew what was going on. And so my closest friend passed away of breast cancer when she was 37. We were both doctors, joking around. She said, oh, I've got this weird thing in my neck. Wouldn't it be so strange if I had lymphoma? And I looked at her and I said, that's not funny, right? That's just not even a funny joke. 2 weeks later, we are putting a port in. She's been diagnosed with breast cancer, but she's a doctor, very knowledgeable. Her mother never told her that she had had a cancer, an ovarian cancer. Her father had a diagnosis of prostate cancer. Her mother's sister had a diagnosis of a gynecologic cancer, which we now know was an ovarian cancer. And her family turns out to be a gene carrier. And so I think that one of the myths that I really stress to our community, and our community being those of Black and Brown descent, is that we really have to talk about the types of cancers that are in our families. There is an association of breast and colon cancer. There's an association of breast and thyroid cancer. There's an association of breast and sarcomas. So we have to be very honest and open about those things, because these are preventable times. We can prevent diseases from happening. Yes, we can stop smoking, but the number one killer of women from cancer is lung cancer. That is a preventable disease. That is preventable. And I think that we don't stress enough that there are ways to stop people from developing these cancers. And not that you all could have done anything different. That is not what I'm saying. But genetic testing is real and it is important. And there isn't anything you could do differently if you have a gene abnormality. That cancer was coming. You can only try to prevent it by doing all the things that are available now. So that I say that all of that to say, we need to all know our genetic history and know what is out there and how do we prevent diseases and how do we stop things from happening.
And in Letrice's case, knowledge is power. To know to expect it, to know to screen, to know to be on, catch it early. And a blessing that, as you point out, both of them are doing well. But I totally agree. In so many aspects of medical care, we don't communicate enough historically in our communities about what has gone on and what is the risk factors. Knowledge is power. I always say that.
And Valerie, your situation about the pandemic, I can tell you now, having all of us having gotten through the pandemic, or what we've seen as the other side of the pandemic as doctors, people changed their way of operating. Like you said, you were looking for a doctor, it wasn't easy to get into a doctor during the pandemic. And people were doing telemedicine. And I actually had to fight my hospital. I said, I cannot do a breast exam over a computer. I can't do it. I cannot do that. I have to feel, touch, see a whole person. And so I argued to have my patients be able to come into the hospital, because I need a human being. I have to touch a breast to know what is going on with that patient. So it's just so interesting to me that we're still seeing the ramifications of the pandemic, because people are coming in with larger masses. They're coming in with spread of disease to their lymph nodes because they were 3 years out from having a mammogram. And it just prolonged people from being able to come in and get things done. And then, Lauren, I will say this one last thing, and then I'll let these lovely people talk. There was the USTAF task force on breast cancer recommendations. So as a resident, good grief, over 20 something years ago, my presentation was on these task force guidelines. What it said is that women did not need to get a mammogram till the age of 50, and that they only needed a mammogram every 2 to 3 years. And this panel was made up of all men, no radiologists, no oncologists, no breast surgeons, and no women.
Wow.
That entire panel has been rescinded this year. Finally, we are back to people at the age of 40 need to get their screening mammograms. Women who have a family history of breast cancer need to get screened 10 years before the first person showed up with their disease. So at this point, and this is 18 years since I gave that presentation, to see that we are just now getting to the point where someone has agreed that people should get their mammograms starting at the age of 40 again, and that they should have them on an annual basis, is incredible to me. And Valerie's situation of falling and feeling something, I would say 7 out of 10 people feel their cancer or know something is wrong or going on before they ever come to the doctor. That fall was her sentinel event, but clearly didn't cause the breast cancer, but was the reason why she was so vigilant on that side of her body, because it was in line with everything that was going on. You know your body better than anyone else. And that is so important. You've got to look, you've got to feel, you've got to do an exam, you've got to get in front of a mirror, because I can see things when you come to me, but people don't always come to me. You know your body and believe your body. Your body is always trying to tell you something, so believe it.
Amen.
You know,
Go ahead.
Oh, I was just going to say, Dr. Bowling mentioned something about getting the genetic testing. It's ironic, and maybe it was because my cancer came so earlier on or what have you, but the oncologist that my aunt is seeing, she too suggested it, that we do the genetic testing, and not only for the family, but for people of color, because she said a lot of the testing is on, the European people. So if we can communicate that to the audience too, maybe you might say, well, I don't have any kids, or well, I don't have any sisters or brothers or whatever. It's for our, population of people, because the studies need to be done. And then the second thing is the communication. I just find it so astonishing that we don't communicate, like you mentioned, Dr. Bowling, about your best friend and her mom not communicating about her cancer history and so on. We do find that in our community, because I can only speak from where I'm coming from, that people don't talk about the illnesses that in our, genetic line. We don't, and I don't know why that is. We need to know what, aunt so-and-so died from, or uncle so-and-so. We need to know that.
I agree. And even just the age of menopause, not many people say, this is the age I went through menopause. So I want to make sure that you know it when they ask you in the doctor's office 20 years from now, that as well. Or hypertension, who has high blood pressure, who has diabetes, what's that family history? And maybe there are factors that are associated with it, and familial or genetic things that predispose you to it versus a new onset of something. So I agree. And hopefully part of this will help people just talk amongst themselves and their families about what those respect. Knowledge is power. So the more we share it and say what we can do. Thank you so much, Dr. Bowling, for that. I want to move on. I want to know how you two felt and what helped you when you were given this diagnosis. Letrice, you were sort of expecting it, but Valerie, this sort of blew you away when you were already stressed by so many other things going on. As we pointed out, life was happening to all of us. So we can start with Letrice, but then go to Valerie. What helped you? What didn't help you? What do this I found not to be at all helpful when my friends or whatever would do this or that, or and certainly compassionate team care like Dr. Bowling offers, to feel like a team's behind you and taking care of all the other aspects that you don't have the knowledge to know, but you can trust in them and have a relationship. I should say this with any physician. So when you find a gynecologist, find one that you like and that you can trust. When you're pregnant, you want an OB doctor who you can trust and have a relationship with, and not just, it just adds to your security and your sense of well-being throughout difficult times. But what was helpful? What wasn't helpful? How did you feel when you were given that diagnosis, expecting that maybe this would come one day, Letrice?
Yeah. Lauren, you said that, and I was like, okay, thinking back, the first thing that came to my mind with your question was, of course, my God, and then my mother.
Amen.
My mother, no one's a stranger to my mother. And Lauren can attest to that. And just my mother, her saying at the time was, we come from, we're tough cookies. Our bakery, we have a strong, within us, we have this fortitude of getting through stuff. So I just knew that I had to get through this. And with the breast cancer, it was my husband, my God, my mother, my husband. I just had a support team. And you mentioned doctors, Lauren, and I was thinking, okay, who are my doctors at the time for the breast cancer? I want to go back to my second diagnosis of Hodgkin's to show you how God puts people in place to help you through things. With the second bout of Hodgkin's, I'd gone through a bunch of quackery. I've been diagnosed. Now, understand, I've already had my first bout of cancer and got through the remission period of 4 to 6 years. So we thought I was clean. So I was done with all my 6 month, 3 month, 6 month, 9 month annual appointments. So I've been diagnosed with, fibromyalgia. I've been diagnosed being anorexic. I've been told that I was having a mental breakdown. No one went back to see, is this woman, this young lady, having a effects or reoccurrence of cancer. Until my mother broke down at work one day and, because my gynecologist at the time, Archimedes Diamante, don't know if he's deceased or not, but that name is forever etched in my mind. Archimedes Diamante called me at the age of 21 when I was at work, told me that I needed to have a complete hysterectomy over the phone, 21 years old. I broke down at work. My mother broke down at work and she's crying. One of her coworkers said, go to this doctor. And you know the doctor I'm about to say, Lauren, Patricia Boatwright in Chicago.
Oh, yeah.
Greatest doctor, one of the greatest gynecologists on the planet. So she diagnosed me with having the cancer. She looked at me. She, did her observation and said, let's talk. And she recommended an internist. So that relationship felt good. So I wanted to go back to that, to just stress, make sure you feel comfortable, as Valerie had expressed her discomfort with the first doctor. Make sure you feel good about the doctor that you're working with, first and foremost. But that's what got me through. My God, my husband, my mother, yes, it was a shock, but again, I had expected it. It was just when. It's like, okay, put on my armor. Let's go at it. Let's go get it, as my husband says. Let's go get it. So,
amen. That's good. Yeah, some people, I can't imagine. There's different things. I deal with telling patients who are pregnant things that are not so great about their pregnancy and what's going to happen, and I, it's challenging. Sometimes you can focus on something positive about what's going on, and sometimes there is very little to find that's positive to talk to them about. But I think they appreciate knowing what's going on, knowing here's what we can or cannot do. But knowledge is power as well, even if it's the knowledge that, I'm sorry, this baby's not going to make it. But with cancer, there's strategies and things, and there's, Dr. Bowling could certainly speak to it more than I, risk factor, prognostic factors and other things but I personally don't like to snatch away all hope from a patient, unless, if I can leave some hope there. My glass is always half full, it's never half empty. And so, it's funny. Valerie, what helped you?
What helped me?
Yeah, we knew how you feel. I guess you were shocked and then, just blown away and but what helped you?
I was really shocked. And one thing I would like to say that anybody, first and foremost, find doctors that you trust, because you never know when stuff like this may come up. If you can find a doctor that you can trust and go see regularly, then you can kind of prevent, like, get through the early, you catch stuff in the early stages of that sort of thing. But with me, yes, I was really shocked. And what kind of made the matters worse for me is when I knew that my gynecologist at the time didn't think enough of me to even refer me to someone would be more knowledgeable than the guy that she sent me to do my biopsy. Because when I researched him, he had terrible reviews. Someone said that he had, she was 3 days away from having a double mastectomy, and she got a second opinion. When she got the second opinion, found out that she didn't have cancer at all.
Oh my goodness.
This was from this surgeon, and he was just a general surgeon that does appendix and that sort of thing. And I'm like, why would she send me there?
Yeah.
And so even after he kept calling me and they didn't have my results, she sent me a card in the mail wishing me well, still not telling me what my results were. So like I say, a big part of getting through anything is making sure you have the right doctors on board with you. And
thank you for listening in today. Weren't you inspired, encouraged, and uplifted? We hope so, because we're praying the best for you. Join us again next time for more betterment, because the better you are, the better you are.